Yes, ma'am. Yes, ma'am.
Yeah.
Okay. Shall I start, Shivam?
Yes, ma'am.
Hello, everyone. Good afternoon to all my dignitaries, guests, and delegates with great joy and immense exultation. I'm Dr. Nikita Kumari. I'm Associate Consultant at Sitaram Bharti Institute of Science and Research. On behalf of the Adolescent Health Committee of AOGD, I feel privileged to extend my warm welcome to all present here to discuss on today's theme, Challenges during COVID pandemic in young population. WHO has defined adolescents as individuals in the 10 to 19 years age group and youth as 15 to 24 years age group, while young people cover the age range 10 to 24 years. Adolescence is a complex transitional phase and is one of the most rapid and formative phase of human development. It is a critical phase for achieving human potential. Investing in adolescents not only ensures that they are healthy today, but also they grow into healthy adults in future. As per the report in 2021, India has the largest adolescent population in the world, around 253 millions, and every fifth member is between 10 to 19 years. And this makes adolescent health crucial to achieving the country's sustainable development goals. Hence, it is imperative to keep our adolescent and young population safe, healthy, educated, and equipped with information. Due to the COVID-19 pandemic, this has created drastic shifts in daily life and routine activities. When it started in around March 2020, several countries imposed lockdown and social distancing measures. On one hand, it has presented as an opportunity for more family time, time for resuming hobbies and interests, and an opportunity for an individualized pace of learning. But on the other hand, many youth may be at risk of increased domestic violence and maltreatment. Together with massive loss of lives and abrupt change in day-to-day life, COVID pandemic has led to adverse effect on adolescent mental and as well as overall general health. Given that childhood and adolescence are crucial periods of brain maturation, the psychological effects of trauma, poor mental and general health can be long lasting. Hence, today, we all have come together in an endeavor to discuss these two very important aspects of adolescence and young population, mental health and overall major health issues. With all these words, I'm extremely delighted to have with us the chief guest for the day, respected Dr. Achla Batra ma'am. Ma'am needs no introduction. You have made all of us proud with your distinguished work in numerous capacities. Ma'am is professor at the Department of Obstetrics and Gynecology at BMMC and Safdarjung Hospital, New Delhi. She has been the President, NARCHI Delhi Chapter 2018 to 20, Chairperson Urogynecology Committee 2019-21, Chairperson for Rural Health Committee 2017-19, Honorary Secretary AOGD for the year 2015 and 16, ex-editor for AOGD and NARCHI, and she has been a dedicated postgraduate and undergraduate teacher for over 35 years of experience. She has conducted various research projects and has been an author of Workbook of Obstetrics, CBS published in 2015. She has contributed several chapters in books and several original research papers in international and national journals are to her name. She has been a reviewer in national journals and contributed to several Ministry of Health and Family Welfare guidelines. Thank you, ma'am. Please, I would like to request ma'am to share some pearls of wisdom on this topic. Dr. Achla, ma'am.
Thank you, Nikita. Thank you for the kind words.
Thank you.
And it is at the moment, a little.
Ma'am, we can't hear you.
It has left its mark, especially on the adolescent population, really affected because they lost their.
Ma'am, the voice is not audible clearly.
मैम का इंटरनेट थोड़ा अनस्टेबल हो रहा है मुझे लग रहा है.
Yes.
Ma'am, please unmute yourself, Ashla ma'am.
Yeah. Hello. Hello.
Yes, ma'am, we can hear you now. Yes, ma'am. Ma'am, I think you can switch off your video because this thing, internet is unstable. Yeah.
Your internet is weak, I think, ma'am.
Yeah.
Yeah.
Now you can hear me?
Yeah, now we can hear you.
Yeah. So I was saying that though the COVID has gone physically, but it has left its mark, mentally, especially on the adolescent population, because they were the ones who lost their school going times, the time they spent with their peers. They were all left at home only with the, internet and videos, which has affected their mental health. It has affected the mental health of most of the people, but adolescent being a transition phase when they're changing, as such, they have some mental issues. And on top of that, this they're being alone and all cooped up at home has really left a mark on the adolescent. And we need to now, get them out of this situation. And I think Dr. Anita and Dr. Sujatha has planned this webinar, which is really apt at this time when we need to now recuperate and repair the damage which has been done. So I'm very happy to have Dr. Kiran Chabra, Dr. Anita, Dr. Sujatha, and my dear old student Nikita in this webinar. So thank you very much for doing this from AOGD. This is a really needed webinar. I think people are going to benefit from it. Thank you. Thank you very much.
Nikita, unmute yourself.
Unmute.
Yes. Thank you, ma'am, for your enlightening and wise words. Next, I would like to take this opportunity to introduce the chairpersons for the session today. Please join me in welcoming Dr. Anita Rajoria, ma'am. Dr. Anita Rajoria, ma'am, she is the chairperson of the Adolescent Health Committee of the AOGD. Ma'am similarly needs no introduction. She has always provided us the platform and has given continuous support. She is a senior consultant and HOD at Department of Obs and Gynae, Sardar Vallabhbhai Patel Hospital. And her present affiliations include Asia and Oceania Federation of Obs and Gynae, FOGSI, Association of Obstetrics Gynecology of Delhi, Delhi Gynae Forum, NARCHI, IMA, and many. Her major achievements include founder, Vice President, Delhi Gynae Forum Southwest, Chairperson, Adolescent Health Committee, AOGD 2021 to 23. She has been past Chairperson, Reproductive Endocrinology Committee, AOGD in 2019 to 21, Executive Member, Outreach Committee, NARCHI, Delhi 2021, and many more. Ma'am has been faculty as various international, national, and state level conferences. She has been honored with Dr. APJ Abdul Kalam Appreciation Award, Wonder Foxian Award, Inspiring Gynecologist of North India Award, Foxy Friends Felicitation Award, and many more to her credits. Ma'am has been editor in Foxy Endocrinology Committee newsletter, and she has various scientific papers in national and international journals, contributed chapters in various books and newsletters as well. Thank you, ma'am, for your presence here. Next, I would also like to introduce Dr. Mrs. Kiran Chabra, ma'am. Ma'am is also a very known personality. She is a senior consultant, gynecologist and obstetrician and director at Chabra Medicare Center, Pitampura, Delhi. She is General Secretary for Delhi Gynae Forum Northwest and member of the QI Committee of AOGD for the year 2021 and 23. And her special interest is in high-risk pregnancy, infertility, and minimal invasive surgery. Ma'am, I welcome both of you for this session. And now I would like to request Dr. Anita Rajoria, ma'am, to please say a few words and also invite our first speaker for the session.
Good afternoon, everybody. I welcome you all on behalf of Adolescent Health Committee. I'm really privileged to have Achla Batra ma'am with us this afternoon. And Dr. Sujatha will deliberate a very good presentation on various health challenges faced by youth today. Welcome, Dr. Kiran also. Nikita, you are doing a good job. And I'm really honored to have all delegates with us on this day today. We recently had Youth Day on 12th, as Achla ma'am has already highlighted. We wanted to do this program on 12th, but there were so many back-to-back, events which were done by Foxy also. So we postponed this to today, so that more delegates can benefit from these two lovely presentations which will be made today. So first presentation will be by Dr. Sujatha Dast. She is my co-chairperson. Can I have a CV? She will be talking on health challenges faced by youth today. Dr. Sujatha Das is CMO NFSG at Vardhaman Mahavir and Safdarjung Hospital, New Delhi. And she has main interest in preventive gynae-onco, gynae endoscopy, and she's very passionate about adolescent health work. She's done a special fellowship in gynae endoscopy. She's a trained colposcopist, and she's trained and certified ultrasonologist in OBGYN. She has held position of Joint Secretary ISCCP 2018-20, and she's co-chairperson with me now and helping me a lot in conducting various academic activities, public health activities, etc. She has been awarded for outstanding performance in cervical screening at NACHI National Conference 2019. She has got more than 50 presentations in national and international conferences, including various scientific paper presentations. She's a life member of AOGD, Foxy, IAGE, DGS, NACHI, etc. So over to you, Dr. Sujatha, for your presentation. We will love to hear what challenges as an adolescent or a young adult a person faces, especially in current COVID crisis. So over to you, Dr. Sujatha.
Thank you very much, ma'am, for this.
I would just like to interrupt. Dr. Pankaj has just joined, so I also welcome Dr. Pankaj, but we can have his session after Dr. Sujatha's session. Thank you, ma'am.
Thank you very much for this kind introduction, ma'am. And under your blessings, under the blessings of Dr. Achla ma'am, we have conducted this webinar, a very relevant webinar for our young doctors and postgraduates and senior residents and all the faculty members. So, Dr. Nikita, will you stop sharing, because I just shared my screen.
You can share.
I can share. Okay, so we will be having two presentations as far as today's webinar is concerned. During this COVID pandemic times, it is very, very important to touch upon the relevant topics as well as the concerns, especially in the young population, since we have a team of doctors and postgraduates who have been working tirelessly during this COVID pandemic times. So I will be taking the major health problems in adolescents and the young population, and Dr. Pankaj will be talking about the mental health issues in the young population. So starting with the presentation, the slides are not running.
Just click on the slide.
Yeah. So the overview as far as this presentation is concerned, that is adolescence. What is adolescence? The importance of adolescent health, as well as the stages in the adolescence. What is the scenario worldwide and in India? The growth, physical, psychological, and the sexual growth, the health problems prevention, and adolescent health programs. In very briefly, the adolescent health programs will be touching upon. So as far as the adolescence is concerned, this actually means the phase of transition of an individual from to the population which we call the young population. The origin is from the Latin word adolescence, which means to grow or to mature. The phase of the human development encompasses the transition from childhood to adulthood. The WHO says that the age period between 10 to 19 years for both the sexes, married and unmarried couples, is the adolescent age group. So as far as the stages are concerned, what are the stages? The early adolescent, mid-adolescent, and the late adolescent. So why have we divided this into early, mid, and late? Because the problems, the concerns are slightly different when we consider the age group of 10 to 13 as compared to the age group of 16 to 18. So the early adolescence is 10 to 13 years. It's characterized by the spurt of growth and the beginning of the sexual maturation. The young people start to think abstractly. The mid-adolescent, which is approximately 14 to 15 years of age, the main physical changes get completed while the individual develops a stronger sense of identity, relates more strongly to his or her peer group. Thinking becomes very reflective in this age group. So for the late adolescent, which is 16 to 18, 19 years, the body takes its adult form while the individual now has a distinct identity and more settled ideas and opinions. So if we compare the concerns which we have amongst the adolescent age group, the concerns are slightly different when we compare the early adolescent with the late adolescent. So why adolescent? Why we are talking about adolescent health and we are stressing upon this adolescent health so widely is that there are major physical, psychological, and the behavioral changes that takes place, the sexual maturity and the onset of sexual activity, the development of adult mental process, as well as the adult identity, health, responsible parenthood, the great human sources, the growth spurt, and there are concerns of menstruation and pregnancy. So if we talk about the Indian population, approximately 21.5% population is actually the population which is comprised of the adult population. So it is very, very important for us to understand that this is a transition phase. The problems which are actually reflected later in their lives actually start from this age group only. So it is very, very important to understand the problems which are arising in this age group, how to tackle them, and what solutions we can give. So if we talk about the adolescent worldwide, around 1 in 6 person in the world is adolescent. That is approximately 1.2 billion people, which is a huge number and it's a huge population we should consider. Most are healthy, but there is still significant death, illnesses, diseases among adolescents. Promoting healthy practices during adolescence and taking up the steps to better protection young people from health risks is critical, very, very important, and very, very critical for the prevention of so many diseases, so many illnesses, the prevention of drug addiction, the problems of alcohol. There are so many things which we can prevent if we consider these concerns early in their life. So as far as the adolescent program is concerned, it is very, very important to consider the RTSK program, which is actually there with us for the last 10 to 15 years. And if we talk about the adolescent population, since we have there's an estimation of approximately 21 to 23%, half of the group is sexually active before marriage. It's a concern. The fertility rate again is very, very high at adolescents. Unsafe motherhood, the MMR and the IMR rate is again very high. The low knowledge about the family planning and the healthy sexuality is again a topic of concern. So if we talk about the comprehensive adolescent health package, so what we are actually talking in these programs is that we need to promote the mental health and the well-being, improving the access to the nutrition and the healthy food, promoting physical activity, improving the healthcare seeking behavior, which is very, very important. I would still say that adopting healthy practices early in their lives will definitely have a very long-term benefits. Since we have a large population as far as the adolescents is concerned, approximately 21 to 23% of the Indian population, we have a huge opportunity to train them and to teach them and to have them as an asset for the country. The promoting safe environment, yes, reducing and minimizing harm and substance abuse, again, a very, very big problem in this age group. The use of alcohol, drugs, and substance abuse, again, a very, very major concern. Promoting the sexual and reproductive health and the healthy practices. So almost half of them actually suffer from nutritional anemia. Young population between the age group of 10 to 15 years make up almost of the 50% of the new HIV cases. If we talk about the adolescent, the age group which the World Health Organization has defined as 10 to 18 years, the young population is between 10 to 25 years. So if we talk about the physical growth, we all know the changes that are taking place, the increase in height, increase in weight, and there are certain changes. Psychological growth, again, is a very, very important aspect. And Dr. Pankaj will be talking about this in a very elaborated way. So as far as the psychological growth is concerned, there's less interest in the parental activities. Sometimes there are mood swings, intense relationship with the same or the opposite sex friends, increased cognition, increased need for privacy, lack of impulse, increased intellectual ability, and risk-taking behavior. So this is the age a very tender age, and we have to actually pick up the problems concerned with these things. The adolescent and the family life education. Educate the growing children, especially the adolescent, regarding the various aspects of living in a society. It is very important. Living in a society and interacting with others at different levels, along with imparting the age-appropriate knowledge of biological and sexual development. Whatever information we are imparting to them, it should be age-appropriate. It should be appropriate as far as their concerns are concerned. The two kinds of needs, their current normative needs associated with the changing physical, sexual, cognitive, social, emotional development, and of course, the future family-related needs. So as far as the family life is concerned, the human relationships are important. Adolescent development is important. Values, morals, ethics. The family as a basic unit. They need to understand the family as a basic unit. They need to share their concerns with their parents, with their friends, with their teachers. They need to understand that there are solutions to each and every problem. The decision making, again, is very, very important. Problem solving, and they have to think about the careers, goals, and plannings. But yes, they need to discuss it with their parents, teachers, and their friends. The adolescent mental health, non-communicable diseases, the mental health illnesses result in a very high level of medical, social, and economic burden. Most of the adult mental health disorders have their own onset during their childhood or adolescence. So it is a very, very important, according to one survey, approximately 70 to 80% concerns which are actually seen later in their lives originate from this tender age also only. So this is very, very important to handle the adolescents and to tackle their problems, listen to their concerns at this tender age. So we have programs like school programs at the level of the college, and we have conducted programs at various schools also, and addressing their concerns. Most of the adult mental health disorders have their onset during their childhood and adolescence. In the low and the middle income countries like India, adolescents and the mental health needs often remain outside the safety of any healthcare system. Again, a very big concern. The effective way to address is by enhancing the primary care in the recognition, of course, the involvement of pediatrician, the treatment, referral of adolescents to the mental health specialist. So it is very, very important that the Indian Academy of Pediatrics observe this year 2000 as a very special year, and the year of celebrating this at a year of adolescents on 1st August. And after that, there were so many policies from the government of India and setting up the adolescent clinics and SHAN clinics. So as far as the sexual concerns are there, again, a very, very important aspect. It encompasses the entire range of thoughts, feelings, fantasies, emotions, desires, action, and perception, which is, again, a very, very important aspect, since we are seeing so many crimes, including the sexual crimes, and we are receiving these survivors in all the hospitals, including our hospital also. So it is very, very important. So why these the crimes are happening every day, every second day. So it is very important to inculcate that feeling, that their feelings, fantasies, emotions, desires, as well as the perception towards sexual behavior is important. The sex education is important in all the stages, but is more important if it is imparted early in their life in a right way. It should have the right contents, and adolescents are benefited. The sex education on self-awareness, the personal relationships, human sexual development, reproduction, and sexual behavior. The human sexuality is a function of total personality, attitude towards being a man or a woman, and relationships among the members of the same sex or the opposite sex. Again, a very, very important aspects for the young population to understand. So we should help the adolescents as doctors, as parents, should help the adolescents to understand their sexuality, learn to respect the feelings, and to make the responsible decision. Sexual relationship involves the respect, trust, and caring of the partner, perceiving the needs of the partner, and feeling free to communicate. Again, a very, very important aspect, as if we talk about the nutrition. There are problems of undernutrition, there are problems of overnutrition. Undernutrition leads to the impairment, growth, anemia, iron deficiency. Anemia is very, very common in our country. The prevalence of adolescent girls ranging from 20 to 91%. The NFHS3 prevalence in 15 to 49% is approximately 56%. The prevalence is very high. In men also, it is approximately 24%, but yes, it is much more in the women population, the female population. The reasons for iron deficiency is that the increased requirement which is not met There's a loss of iron through the menstrual blood also. Dislike of food. They are a little choosy. They don't take everything which they are actually recommended, and frequent dieting. Obesity, again, a very, very important health issue. The prevalence of obesity and overweight is approximately 11% and 14%, 14.2%. The prevalence is higher amongst the boys. There are disorders as far as the eating habits are concerned in the form of bulimia nervosa, anorexia, and binge eating. So have we talked about the adolescents and nutrition? The early adolescence is marked by a rapid growth phase and pivotal changes, during which time the nutrition requirement is different as compared to the late adolescence when growth has actually stabilized. So as I earlier said, the concerns, if we talk about the adolescent age group, the concerns are slightly different in early adolescent as compared to the late adolescence. When we talk about the behavioral changes, again, the behavioral problems are again a very, very important aspect to address. Drug experimentation, again, a very, very big issue. Substance abuse, the use of tobacco, alcohol, illicit drugs, risk behavior, having the risk-taking behavior in the form of rash driving or self-harm, violence, and bullying. The social factors which are important in adolescent health is the parents' perception. It's very, very important. They should be aware that these problems are likely to be seen there. This is life. The problems are there. The problems will be there, but then there is a solution to each and everything. There's less female literacy, economically weaker societies, health-seeking behavior was neglected, and the adolescents were not told whom to consult, where to go, and whom to ask. So as we talk about the prevention, there can be primary, secondary, and tertiary prevention. So there are various programs as far as the adolescent health is concerned. There is a Kishori Shakti Yojana, Balika Samriddhi Yojana, Reproductive and Child Health Program, is adolescent-friendly health services. It's actually the main thing which we are talking about, the National AIDS Control Program. So as far as this strategy is concerned, the priority intervention area of adolescent health, adolescent nutrition, and IFA supplementation is very, very important. The facility-based adolescent reproductive and sexual health, again, is a very important aspect. Information counseling on adolescent sexual reproductive health and their behavior. Menstrual hygiene, again, is a very, very interesting and a very important topic. And there are health checkups also for the adolescent age group at the school level and at the hospital level. So the nutritional education system to generate the awareness on the balanced diet, nutrition, and effects of malnutrition, the nutrition education systems through the ICTS school curriculum is again a very important thing. So we all know that there are programs and initiatives that the government of India has taken to prevent or to manage the prevalence of anemia in our country. There's something called this scheme, which is covering the adolescent age group of 11 to 12, class level 6 to 12. The key features are there's a weekly supervised administration of IFA tablets, screening of target groups for anemia and referral, biannual deworming, and information and counseling from improved dietary intake and prevention of bone infestation. Services which actually are provided in the adolescent services. Yes, we have an adolescent clinic at our institution also, and which is handling all the concerns of an adolescent age group. We have a pediatrician there, we have a gynecologist there. The clinical services, the general physical examination, nutritive advices, detect and treatment of anemia, easy and confidential assessment. As far as the termination of pregnancy services are required, antenatal care, not concerned. We have not seen any patient. RTI, STI, yes, again, is very, very important. And the concern as far as the anemia is concerned. As far as the information and counseling on the adolescent sexual health is concerned, the life skills are again very, very important. We should develop these skills, that's life skills, and we must make them understand that this is life. The problems are there, the problems are going to be there, but one should know how to handle it, how to tackle it, and how to inform to your parents as well as the teachers. The life skills, the ability for adaptive and positive behavior that enable the individuals to deal with effectively with the demands and the challenges of everyday life. It is very important and given by the World Health Organization. A behavioral changes or behavior development approach designed to address and balance the three areas, the knowledge, attitude, and skill. It is very important, and we have stressed upon these very important points as far as adolescent health trainings are concerned at our institution for our interns and young doctors. So teaching through the participatory learning methods like games, role plays, group discussions, practicing skills are important to provide the individual with quite alternative and creating way of solving the problems pertaining to drug abuse, sexual abuse, teen pregnancies, early sexual experimentation and bullying. And there are robust evidences and surveys also that shows approximately 20 to 30% of the young population is actually indulgent high-risk behavior like alcoholism or rash driving or unsafe sexual practices. So this is to be taught at the level of the schools: critical thinking, creative thinking, decision-making, communication skills, coping with the emotional stresses. Again, a very, very important aspect, self-awareness and empathy. The life skills and education are incorporated through the schools and ICDS programs. And since this is again a very, very important topic, the scheme promotes the better hygiene and education regarding the menstrual health. The educational program, the co-curricular extra activities, and the adolescent education is from 9 to 11 classes. Life skill education, yes, it is also there for classes up to 8th standard. Inclusion of HIV prevention education, inclusion of HIV prevention education, and the programs for out of school adolescents also incorporating the measures to prevent the stigma and discrimination against the students. And we have an HIV policy in place. So if we talk about the adolescents and their concerns, there are many, many concerns as far as the young population and the adolescents is concerned. But it is very important, we as a doctor, as a parent, and as a teacher, to understand their concerns, to address them, and to make them a better individual and a better citizen for the country. Thank you so much.
Thank you, Dr. Sujatha, for that wonderful presentation. You have highlighted almost all the health care related issues that we face daily with our adolescent clients. I just wanted to reiterate what she has said, that these adolescents, they can come to your adolescent health clinics with a lot of self-esteem and body image issues also. And teenage pregnancy is another very, very important thing. And we must be very, very sensitive to these adolescents because of inherent problems associated with teenage pregnancy, anemia, and so many other things are related to it. Then they have transition problems also, transitional healthcare issues. I think Dr. Pankaj will be dealing with them in great detail. Then these younger adolescents, they have to be taught about, safe touch. So that is very important. Then early marriage is an issue in our country, and we have to educate our adolescents regarding contraception, which contraception they can use, which is safe for them, then how to counsel them for dual contraception so as to avoid, acquiring STIs also. And they have to be taught that if the need arises, we are there to help them, and they should not fall prey to unsafe abortions if they land up in teen pregnancies or so. Then PCOS is another very important issue, which because of lack of time, I think Dr. Sujatha could not cover. But we must understand that adolescents are feeling shy to come even to healthcare professionals. So we have to be very, very sensitive to their concerns, and they may just give cues. They may not come with their problems directly. So we have to be very empathetic to them. So thank you very much, Dr. Sujatha. If there are any questions, we will take at the end of the second session. So over to you, Nikita. Thank you, Dr. Sujatha, for that wonderful presentation.
Thank you very much, ma'am. Thank you.
Thank you, ma'am. Indeed, it was a very wonderful presentation covering all the aspects of overall general health. And now Dr. Pankaj is also there. I would like Dr. Kiran Chabra, ma'am, to please welcome Dr. Pankaj for his presentation. I'll just share his.
Thank you, Nikita. Please share the slide.
1 second.
Meanwhile, Achla ma'am wants to make any comment till she puts the presentation.
I think it was a very nice presentation covering, first telling what adolescents are and what problems they face and how COVID has, aggravated their problems. And I think Sujatha has completely dealt with that topic. And let us now first welcome Dr. Verma. Welcome to our forum again.
Yes. Welcome, Dr. Verma. Nikita, will you share?
Been very fortunate in whenever we wanted him, he's always come to our forums and given his very good inputs. So let us see what he has to say. I think Nikita.
So we welcome Dr. Pankaj Verma to this platform and to this Adolescent Committee program. Dr. Pankaj Verma is a specialist professor, Department of Psychiatry, Safdarjung Hospital and VMHC, New Delhi. He has over 14 years of experience. He has numerous research articles and publications. His other experiences are that he was appointed as a nodal officer regarding COX patients referred from LRS Institute to a Department of Psychiatry, Safdarjung Hospital, New Delhi. He has been a member of board for issuing mental disability certificate in Department of Psychiatry, Safdarjung. He is member of Delhi Child Protection Unit Inspection Committee, South District. He is also the member of Hospital Management Committee. He is the member of Repair and Maintenance Committee and member of Housing Allotment Committee as well. He is Department Nodal Officer for NABH. So welcome Dr. Pankaj Verma. After listening to Dr. Sujatha with all the major health issues, we are now going to listen from Dr. Pankaj Verma about what are the mental health issues of the adolescent group. So over to you, Dr. Pankaj. You are
Experience about handling these adolescents as a healthcare provider in private setup.
Basically, they come to the private setup with their mothers or sometimes with their friends, but they don't open up. Whatever complaints they have, the complaints are shared by their parents only, or the pair who is coming along with the adolescent girl or basically a girl. Most of the times they come with white discharge problems and they never come up with any mental issues or some abuse, I will say alcohol or tobacco abuse or things like that. But majorly they come to us for white discharge, or if they have any lesion on the vulval area, or if they are pregnant. They never also ask for any contraception. Neither they ask for any other. We have to actually ask them, poke them, and take the things out of them to know what they are going through.
Is sir ready? Dr. Pankaj, are you ready? I don't find any questions in chat box as yet regarding Dr. Sujatha's presentation. Then regarding nutrition is very important aspect of adolescent healthcare. We must understand that we have to give them adequate calories because they need extra calories for gaining height and gaining muscle mass, etc. So female adolescents usually require 2200 calories per day, while males will require higher calories, 2500 calories per day. Then you need to give them additional fat, calcium, iron, zinc, vitamins, etc. But on the other hand, we have to understand that rising obesity is a problem in our youth nowadays. So we have to be, very careful in giving them calorie allowance as far as it is concerned. I was just reviewing the literature. I was trying to find out what was the contraceptive awareness amongst our adolescents. As Sujatha ji has already highlighted that majority, like 40% or 50% of adolescents have been exposed to sexual relationships during adolescence, and only 30 to 40% of them were aware about use of contraception, and that too dual contraception, so as to prevent pregnancy as well as sexually transmitted infections. So as a healthcare provider, we must fulfill our responsibility for counseling these adolescents regarding these important issues. So Dr. Pankaj, are you ready, sir? You can unmute and try once, sir.
Please unmute yourself.
Am I audible?
Yes, sir. Yes.
Yes, 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 sir.
Okay. Today is a day jahan sab goof up ho raha hai. I'm sorry.
Never mind.
Issue, sir.
Sorry. On the onset, I will like to thank AOGD for giving me this opportunity, and I'll say thank you, Nikita, for giving the introduction. Respected Madam Achla Batra, for always showering love and niceties to me. Thank you, Dr. Rajoria and Dr. Chabra, the chairperson. My senior colleague, Dr. Sujatha, has wonderfully explained about all of the, I would say, major of the problems which I thought I would be discussing. So if you have a good speaker before you, then there is a problem what to say and what not to say. Okay, so I'll try to confine myself to adolescent facing problem these days. I also have a son who's in class 12th. So everybody expect that I'll be dealing it very skillfully with him, and he will be listening to me, and everything will be a smooth roll, which is not exactly.
Which is not exactly.
Even I am facing the similar kind of problems which every other parent of this age group faces. Let me just
Peer group pressure.
yeah. See, what has happened in last 1.5 years, nobody has experienced this ever. And even as a psychiatrist, when we call ourselves as a masters of brain and mind, and we know everything, it was a very learning experience. And still we are learning. Every day what we are finding is parents coming to us with similar complaints that children are not studying, and they are hooked to the what do you say, internet
Devices.
games and
Internet devices.
internet devices. I've been fortunate that 2 years back we were working on guidelines for internet addiction. With the NCDC was the primary caregiver, jahan they were trying to make out these guidelines. Whatever we made, exactly that is not happening. The teachers are not understanding what to do. The students are not understanding what to do. So these are the new challenges which we have come across, and I thought this should be discussed in this forum. Let's start with certain stats. These children, they are very prone for depression. As high as around 27% in the females, female adolescent children, and rest as high as 15% in total adolescent cases. They have this anxiety and depression, which has increased within last 1.5 years. I'll be talking about how they present, but let me just do with the stats and then we'll move forward. every other child is saying that I'm less motivated. I am not feeling that what should I do? My son, who scored 95% in 10th, has stopped studying, and he says, I don't feel motivated enough. What is making them feel this? Because they have lost the touch with the surrounding. They have lost the touch with their peers. They have lost the competition edge which they were having, which were motivating them. Because we always study how the next person has studied. So we used to compete. But now that edge has gone. We are sitting in front of a laptop. See, I'm using my daughter's laptop. That is why this goof up was there, because I was late and she did all this arrangement for me. So I did not know how to arrange. So, and she is in just class 8th. So everybody is having their own laptop. Everybody is having their own phone. And now the access is free. They can do this, access the internet anytime. So they are less motivated. They don't know. They are not going out. They are not meeting their peers. The competition has gone. Now their competition is with themselves. कि मैं आज कितना score किया और कल कितना score किया. That is the only competition. And when there is no control, this competition goes away. Games में आ जाता है कि मैंने कितना score किया और उसने कितना score किया. You'll be surprised to know that 3 out of 4 people, they felt that there is a need. I require some help. And there is something wrong with me. We are getting these kind of cases every day. But what we see is only the tip of the iceberg. Despite knowing that they have this problem, only 2 out of 5 people are coming to us. And only 1 in 3, they actually follow what we are trying to tell them. The worst thing is the disconnection between the family. People are unable to move to their close family, like the joint family system, which was earlier giving a buffer, is now not there anymore. And more so during, this was felt more so during this pandemic time. Dr. Sujatha rightly said, we have so many things which can have a lasting impact on the adolescent brain, like traumatic brain injury, like depression, anxiety, PTSD, unintended pregnancy, HIV, cancers, because they don't know where to stop. They keep on testing their boundaries, and the risk-taking behavior is more. So HIV and STDs are very common. So cancers are not that common, but cancers in the family member and the diabetes in the family, they can also have their adverse effect, because when we are talking about an adolescent, he's taking clues from everywhere. His immediate environment, immediate family, extended family, his peers, his playmates. So if he is having, he finds that somebody is suffering from cancer or a diabetes and they have a life modifying illness, even that have a very serious impact on them. Then, as Dr. Sujatha rightly said about the alcohol abuse and the unsafe practices, so these are the things which affects, because they are in a very tender age, they don't know how to cope with this. Whenever there is a stress in life, either we internalize things or we externalize things. See, when we internalize and do not share with people, there are certain effects going inside our brain. And when we try to find out, there will be high inflammation rate, low GABA, and high arousal. Whereas those who can externalize their feeling and they can share, they have been found to be having low inflammation rates, high GABA, and low arousal of the brain. So it is not that the brain is not affected. Brain is definitely being affected by everything which they are experiencing. See, just a second. Okay. So let's talk about what are the common signs. How can we say that these adolescents are undergoing stress? We'll find that these people are always on the edge. आप कुछ भी छोटी सी बात करते हैं and they just become aggressive, they become emotional, they react. And they react beyond the expected range, which is beyond normalcy. Even they realize they are reacting more than what is required, or they don't want to react that much, but they cannot control. I have so many people who have done. One of my patient recently, he has beaten up his mother, black and blue, and he says, "Sir, I feel sorry. I cannot control myself." And there is nobody to tell me what is right and what is wrong. Whereas the parents were very nice people and they were always caring and always trying to tell him, but they say he does not listen. He always talk to his peers, or he always consult the internet for his problems. So even though he was aware that something is wrong, he did not know where to go. And we as a doctors, we are also contributing to this problem, because till recent times we were not aware where to fit the adolescent, whether to fit with the children pediatric age group or to take them as a adult. I would say recently the ministry has taken this thing that now the adolescent will be taken care by the pediatrician and they will be admitted under pediatrician only. So this is some positive step. So we'll know what to do. When they have a problem and they don't know what is the solution, these people come with anxiety, feeling low self-esteem. A recent patient, he said, "Sir, I feel I cannot do anything." And when you see his marks, those are wonderful. But then this feeling that he cannot do anything was very deep rooted. And the interpersonal problems were growing every day, because parents were there, which was usually not there in the home. But for last 1.5 years, they are working from home, and now they are like a helicopter parents, and they are just not letting him have his own free time. He says, "I am not doing anything which I was not doing earlier, but my parents tell me, हम इतना पढ़ते थे, हम ये करते थे, we have achieved this much, and they are after my life. Though I'm scoring high, I still believe I cannot do anything, because they are telling me every day that I cannot do anything." This can lead to burnout, where child can totally say, I cannot do anything. Now, just leave me like this. I'm good for nothing. What is missing? See, stress was always there. There was always a relieving factor. But those relieving factors has also changed within last 1.5 years. People used to go out, play, used to talk with their friends. Person to person connect was there. When we go out, we meet thousands of different people, which you cannot see on net. And that eye contact, that smile, that hi, hello, will relieve you of your tensions. Now, within last 1.5 years, the coping mechanisms which were there has to be redefined. Even for the parents, even for the teachers, and even for the doctors, because we have to reset this. How to reset a coping mechanism for this particular case. And it is a challenge for everyone. See, everybody faces the same challenges, but the person who has best coping mechanism will react best to that particular situation. Let's suppose if there is a gunfire, an army trained person knows what to do. Half of us will faint. Some will run away. But an army or any armed forces trained person will know how to react and what to do. So this comes from training, and this coping mechanisms are safety mechanisms which we have learned over the years, and this is for our safety. We learn from our ideals like parents or any senior person in the family. The effect, it affects the adolescent brains in many ways. The poor coping mechanism, which is because of decreased communication with the peer. Now you'll find that suddenly the patient was talking to his peers, but now suddenly he has withdrawn. There was a time recently my son started avoiding eating food with us. The family was sitting and he just stopped avoiding eating with us. Then I asked him what has happened. He said, the food I would like to eat in the way I want to eat. You tell me to do this, to do that, eat with a spoon, eat dal roti. So I said, okay, fine. If you want to eat it the way you want to eat, it is fine. But let's be together. Let's sit together. These patients are getting angry very easily, and then when they don't find any outlet, they try to find new ways like playing games, and winning there, they feel that they have achieved something. Or they start playing those games where they're killing something or shooting something, imagining that they are taking their revenge from XYZ. These patients, they do have a poor sleep-wake cycle. Usually they're awake at night and then sleeping throughout the day. Few of them, they sleep very less. And these are the signs and symptoms which are the marker when we find in certain adolescents any change in behavior, recent change in behavior. Should be setting an alarm in within us that, okay, fine, this is what is happening and we should be extra careful. What can be done? see, we need to be telling patient or even our children that you should be regular in your whatever you are doing. Regular studies, regular sleep-wake cycle, regular food routine, regular exercise routine. This will not lead to increase. This will lead to decrease in stress. Because if you are not regular, if you have bad habits, then the stress level will increase. Make a good timetable. Try to follow it up. If you are able to follow it up to 80%, then it is fine. You can improve upon it. But if you are not, and you are around doing 50% of what you have expected, so try to reallocate the challenge, because that challenge which we are trying to fulfill with that timetable, we are not able to follow it. So now reallocate the challenge, start with the lower challenge. Now again try to follow it the timetable. If you are able to follow it up to 80%, then you can work on it. अगर एक ही बार में हमने ज़्यादा challenge दे दिया और the person is not able to follow it up, so that will be a demotivating factor. Then उसका self-esteem और hurt हो जाएगा. So the moment you find, okay, fine, he's not able to find it, reallocate the challenge. Reassure. Tell the person, okay, fine, हमारे साथ भी हुआ था, ये सबके साथ होता है, we'll try to manage and we are with you. Don't think that you are alone and you are facing it alone. Everybody does. And सब निकलते हैं, तुम भी निकलोगे. The words he wants to hear, I'm not saying temper tantrums को fulfill करें, just reassuring and soothing words. Ask him to reconnect with people, reconnect with his peers, reconnect with his favorite uncle or aunt, so that he can share his feelings. Give him some time, give him that space. And then reimagination. We should reimagine what can be done. In psychology, we have to think, okay, fine, this is happening, this is not happening. Let's reimagine how this can be done. And if we are able to help in one way, it is fine. नहीं तो हम फिर से reimagine करते हैं. Okay, these are the things which can be done. You ask fellow peers that, okay, what do you think, how this can be done? Do you have any idea? And you'll find that, okay, fine. Everybody is struggling, so they'll try to find out the coping mechanism for themselves. And one which is working for X might work for Y also. So I'll restrict my this thing for today about adolescent problems that they are facing during COVID. I know there are so many things to talk about the school things. Recently, there were guidelines that even in the colleges and even in the workplace, work from home setup. The guidelines says you work from 9 to 4 only. Tell your boss, now this is my private time. Do not go beyond certain hours. Similarly, in cases of students, they say you can ask your teacher not to disturb you after this time. If she or he is giving you any task beyond the regulated time, you may not do that. You'll be surprised to know, yesterday, no, day before yesterday, my daughter was recording a song for the school at 10:30 p.m. because the madam wanted it to be published, released next day. And the problem was, she was not, whenever she was trying to upload it, the file was not opening. At 10:30, we were all struggling how to make that file work. And my daughter was under very big stress. She's in just class 8, and we told her that you have worked well, you have recorded. Now it's okay if you cannot do that. No, madam, kya samjhengi, kya hoga? And the madam kept on calling. Then I told her, ma'am, please, she's just a kid. Let it be. Nahi hua. Mehnat kari, koshish hua. But the kid was like in tears. Ki nahi, madam kya samjhengi? So we need to understand, we should start saying no. In our department, we recently started saying just restrict this seminar to this 7 p.m. Otherwise, it was extended up to 9:30. We used to start at 5:30, and people were questioning, cross-questioning, and adding up on. And then as a faculty, we were also contributing. So those sessions extended up to 9:30, which was very inhuman. Everybody was sitting. So now everybody has decided, because they said, no, we have to restrict. So 7 is the last. And if some important inputs are there, we extended up to 7:30. So these are the certain things which we need to bring into our day-to-day working. Still, we have to face this problem, and this COVID will keep on for I don't know how many more months. So we have to form new guidelines. We need to adapt, and we need to be ready, and we need to devise new coping strategies for all these things. And we need to understand that adolescents, being a special population, they have special requirement. They are very uncertain about their future. And very recently, they have started experimenting with the life. Till few years back, their parents were everything for them. Now they are experiencing कि okay, मेरे friend के parents अलग हैं, उनके thought process अलग है, and I think everybody has experienced, चाहे अपने से या अपने बच्चों से, कि around 18 they declare that you are old school and you don't know anything. So
practical problems.
Ji ma'am, these are very practical problems, and I thought I should address this because similar kind of problem we are facing in the some department, I will not name that, where the PG says I have not been taught because over this. So today I was busy with that counseling. That is why I got late, and I thought this is the appropriate platform where I should address. I'm sorry for being late and being so clumsy with these gadgets because it's my daughter's system. My system is still not open. Thank you. I'll restrict myself.
So thank you, Dr. Pankaj, for your wonderful deliberation on mental health issues during this COVID times. You were not late, and we all are learning this new technology. What you have said is, like, in COVID times, 2-3 things have come out. One is that the children have stopped sharing their ideas, their wishes with their friends or peers or some uncle, aunt, because they are not going out of the house. Secondly, the activities, physical activities are not there. They are totally hooked to the new gadgets. They have too much access to the technology. So physical activity, which used to channelize their energy, is not there. Because after having so much of physical activity, they were, I will say, their brain was also energized, their body was also energized, tired, fatigued, and they used to sleep on time, have foods on time, have everything on time. Like now that is gone. So we can't blame them because everybody needs a change. We also like changes, and so are our kids. And second, one most important thing which you have said, that now we have started talking about that we should restrain our activities. We should have that capacity of saying no to few things which we think which are not good for our mental health. And it's good that somebody is talking about all these things in India as well. Probably we'll build a new future with all these things, with good adolescent practices. So thank you very much for a very good lecture. Over to you, Nikita.
Thank you so much, Dr. Verma and Dr. Kiran ma'am, for such enlightening words. Kiran ma'am very nicely reiterated what Dr. Verma has told. We can have some question answers, but I'm seeing that there is no yet any question.
Yeah,
And the tight backs.
yeah. Dr. Pankaj, very well presented. We are all learning these, our relationship with gadgets is developing due to this current COVID crisis. ये बात सच है कि जो ना छोटे हैं ना बड़े, बड़ी मुश्किल में वो पड़े. ये जो क्रॉस रोड है चाइल्डहुड और एडल्टहुड के बीच में, हमारे जो एडोलेसेंट हैं, they feel that it is a great challenge for them. So I think I want you to make a comment on cyber addiction and how do you tackle these adolescents?
Cyber relationships.
Cyber addiction means they're always,
to phones and all.
Phones or mobiles or
Instagram.
Ma'am, I'll start with an example. Few years back, one of my colleagues' cousin came and he requested, please give my son a disability certificate stating that he is a slow learner so that he can have some time for his 10th exam. And when we clinically evaluated him, I found there are some traces of ADHD, but IQ wise, he did not look like a slow learner. Even though I got him tested for SLD and the results were as I expected. In fact, his IQ was high among 120 plus, but his pre-board score was 48% only. That person was very good with the PPTs and all those things, which his father used to take for his presentation. He used to take his health. Unfortunately, his father passed away in COVID. But before that, he used to take his health. He said he is very good in this, he is very good in that, but he cannot study. So I told him, I beg to differ. You just take all the gadgets away from him and let him study. And for everybody's surprise, in 3 months, he scored 85% in boards. Wherever he was scoring 48 in his pre-boards. The mother took a leave from her job and dedicated next 2 years for his studies, and that guy scored 95 in his 12th. Not only this, he is an engineer now, and he was working in the same company where his father used to work. His father came before his unfortunate death, and he was thanking me that now my son is working and earning more than what I am earning.
So, Dr. Pankaj, how to take away those gadgets?
Yeah, I'm coming to that, ma'am. I'm coming to that. Ma'am, there is no certain way because I'm failing daily in this task because I have to ask my son to give it back to me, and he's very smart. किसी न किसी बहाने से वाकई में से ले लेते हैं. We cannot be rigid, but we need to be firm. There's a difference between being rigid and being firm. We cannot be rigid, but we have to tell him or her that, okay, fine. Apart from your classes, I'll allow only 1 to 2 hours of screen exposure, which is recommended. Like I told you that NCDC guidelines we had this thing very clearly that only 1 hour of screen exposure apart from the work should be there. Whether it is phone, whether it is laptop, whether it is TV, it should not be beyond that. Because until unless we have person-to-person contact, वो रियलिटी में आता नहीं है, वर्चुअल रियलिटी में रह जाता है और दिमाग हमारा फिर वैसे ही काम करने लगता है. सिटिंग इन फ्रंट ऑफ लैपटॉप एंड दिस ये स्टिमुलेट करता है हमारे ब्रेन को, व्हिच इज नॉट अ हेल्दी साइन. There are other guidelines which I will be telling you later on, but how to deal with this, we need to explain, because now they are not chota and not bada, so we need to explain. We need to explain them about the side effects. We need to explain them about what is happening. We need to tell them. We cannot take away things from them. So we need to tell them this is what it is required, and we are not interfering with your this thing day-to-day activity. We are not saying कि हम boss हैं तुम नहीं कर सकते ऐसा. We are not doing this. We are just making a program कि आप इसके अलावा इतने घंटे आप खेल लीजिए, इतने घंटे आप मतलब फिजिकली एक्सरसाइज कर लें, गेम खेल लें, which is not on any IT instruments and phone, etc. And with every 1 hour exposure, you need to work for 2 to 3 hours without the screen. And if you are working, studying that, you can again have a screen. Okay. Like I told my son that if you are going to play tabla for half an hour, you can play games on mobile for half an hour. We followed it till this thing, COVID. But after COVID, this thing has not been working very, very well because the gadgets are with him only. Then I explained him about what is the right and what is the wrong thing. I asked him, okay, you want a good video game set, I'll bring that. If you want a good earphones, I'll bring that. But only you can use this during these times. तो ये बहुत firmly आपको उसको बताना पड़ेगा कि ये हमें इस टाइम पे ले सकते हैं. Definitely we will fail. तो हमें वो फिर से reassurance, reallocation, reimagination सब कुछ करना पड़ेगा मैम. And every time we need to improve. क्योंकि एडोलेसेंट एक ऐसी एज ग्रुप है जहां पे हम उन्हें ऑर्डर नहीं दे सकते. जितना ऑर्डर करेंगे, जितना हम रिजिड होंगे, उतना वो रिबेलियस बनेंगे. सो वी नीड टू बी जस्ट लाइक ऐसे ना रीइमेजिन कि कैसे कि इनको हम वापस कंट्रोल करें. आई टोल्ड हिम कि दिस कंट्रोल विल लाई विद यू only if you are going to do this. Then very smartly what he did, okay fine, you put your lock on the phone and let it be. मेरे पास कोई मैसेज आएगा मैडम का तो मैं देख लूंगा. I thought I am a brilliant chap. मैंने वो कर दिया without realizing कि they are the technology people, they know much more. उसने उसका भी वाई मीडियम निकाल के वो with lock से बाहर करके and he was using it. One day I realized, so I did a better software antivirus and then I again put a lock. So this is an ongoing thing which we need to keep on doing. और हर एक आदमी को फ्री मील बड़ा अच्छा लगता है. बगैर मेहनत के हम कुछ कर रहे हैं वो तो सबको मजा आता है. So this is what these people will keep on doing and we have to reinvent. Only thing is those who are responsible, they'll understand what are our genuine concerns. And क्योंकि होता है क्या कि ऐसा नहीं है हर जना एक ही टाइम पे मैच्योर होता है. Females are matured early than the males.
And the males, right?
They'll understand your concern in a better fashion कि आप क्यों ऐसा कर रहे हो. Males थोड़े से they are wicked minded and easily distracted. वो कोशिश करने की ज़्यादा. But then this is an ongoing process, and you will succeed someday when they'll understand that you don't mean to harm them, you don't mean to control them, and you are just, whatever you are doing is for their betterment. They'll understand. But एक solution for everything, this cannot be done. Ma'am, इसके लिए ना हमेशा hit and trial, and every person is a different person. So we need to try and test.
What do you say, Dr. Pankaj? Ki parents should set an example, because it is not only the adolescents who are hooked to these systems, even the parents are also hooked to the systems these days. Wife is sitting with a mobile, husband is sitting with the mobile, child is sitting with the mobile. So if you want to ask your child to stop using that, you first have to set an example to ask him or to make him understand that this is required. Only then he will listen to you.
Yes, Kiranji, even I have seen people on dining tables with their gadgets. They are on and they are eating together.
Definitely. So we have to decide some time, like this is eating time, so you don't have, nobody will touch the mobile. Like nobody will do this. So eat properly, chew properly. That those things we have to again and again repeatedly repeat them actually, so that it gets ingrained in their minds.
And Dr. Pankaj had very well highlighted that children are not having meals with their parents.
Definitely.
In majority of the studies, this has contributed to childhood and adolescent obesity, because they are not having meals with their parents, and then they are ordering outside food and
fast food.
Fast food should be called a fat food. I was thinking somebody has very smartly inserted alphabet S. It is actually a fat food.
Fat food. Right.
Totally agreed, ma'am.
This is the I will say a disease or a process in the affluent families. What we are talking about, fat food and all this, is more in affluent families. Younger group or the people with the lower amenities and lower things, they have different kind of problems.
Ma'am, I agree and also disagree.
Okay. Why you disagree?
क्योंकि ये फैट फूड और फास्ट फूड ये उतना ही कॉमन है लोअर सोशो इकोनॉमिक्स.
अच्छा, ओके.
बट हम सोचते हैं कि शायद they cannot afford.
Right.
I was surprised to know that my maid was ordering the similar amount of pizzas and the burgers which we were ordering.
Okay.
Yes, Kiranji, it is.
I have not seen actually this, so I was not aware of this fact.
It is a hard fact, because these unhealthy diets, they are cheaper. To have healthy food, you have to spend more, like getting fruits and all. So definitely, this is not only a problem of affluent societies, even lower socioeconomic status people are having this problem now. So Nikita, we can carry on, or are there any questions, or we call it a day, Sujatha ji? Thank you, Pankaj sir. Very nice deliberation.
Thank you so much.
Yes, ma'am, we can call it a day. And thanks to all our chairpersons, moderators, and Ashla ma'am for their valuable inputs. And thank you very much, Dr. Pankaj, for this wonderful presentation. Thank you.
Thank you all the delegates who have joined us today afternoon. And thank you to all my co-chairperson and Dr. Pankaj, Dr. Sujatha for that wonderful presentation. And Nikita, you did a wonderful job today.
Right.
Thank you, ma'am. Thank you so much.
Okay.
Thank you so much, Dr.
Thank you,
Pankaj.
everyone.
So I think I have collected many tips and tricks for future, because my daughter is very small right now, but when she'll be adolescent, I'll be able to deal, because I understand that parents' perception and the support to children is very important, and that will help them.
Definitely.
Yes.
Most of the times parents don't understand what the child is going through, and they don't listen to them also. So that's important, to listen to what your child is saying.
Yes, ma'am.
Then you can guide him or her.
Of course. Ma'am, it's a vice versa. I see whenever my daughter wants to play, she tells, Mama, please phone rakho, Papa, please phone rakho and play with me. And when she will grow older, we will be telling her, please put your
Yes, yes,
phone.
yes, definitely. Because she's too small now. Because she she's dependent on you. The day she goes out of your dependency, then she will not listen to what you are saying and what you are doing.
Yes, ma'am. Yes, ma'am, definitely. Thank you, everyone. I'm really gratified that I got this opportunity to deliver vote of thanks to all of you. My sincere thanks to Dr. Sujatha Dast, ma'am, Dr. Anita Rajoria, ma'am, the chairperson and the co-chairperson for the Adolescent Health Committee. Ma'am has been always motivating. Anita, ma'am, constantly sends me messages telling Nikita, please do something, please be actively participating. Ma'am, I'll surely do. I'll not let you down. And special thanks to Dr. Kiran Chabra ma'am and Dr. Pankaj Verma sir. Mental health is very important. We should definitely not ignore it. And last but not the least, Dr. Achla Batra ma'am, she has left because she must be busy, but she gave a precious time to all of us. So I'm very grateful to everyone, even the audience and everyone who joined us in this webinar. It was very informative.
Thank you,
ma'am.
Shivam also for giving us this platform.
Yes,
Thank you, everybody. Thank you so much. Bye-bye. See you.
So much. Bye.
Bye. Bye. Thank you, ma'am. Thank you so much.